Hello, everyone. Welcome. We are going to give people just a couple minutes to join us. My name is Lakelyn Hogan. I'm Home Instead's Gerontologist and Caregiver Advocate. And today I'm joined by Kyle Decker. Hi, Kyle. Welcome.
Hi, Lakelyn. So glad to be here. Thanks for having me.
The pleasure is mine. I will formally introduce Kyle in just a moment. But before we get started with today's chat, I again want to welcome you. I want to thank you for joining us for our May Caregiver Chats. We do this every single month on our Facebook property and through Zoom. These Caregiver Chats are sponsored by Home Instead. If you want to learn more about Home Instead and our services, you can visit homeinstead.com. We'll provide the website in the chat and in the Facebook comments. And we hope that you're following us on Facebook. We have various web properties and we always stream these caregiver chats through our Facebook pages, Remember for Alzheimer's, and then we also have our Home Instead Facebook page. So we hope you'll give us a like and continue to follow our Caregiver Live Chat series. We do take questions live on these chats. So I encourage you at any time to drop your questions in the chat box or the Q&A box if you're on Zoom, or if you're on Facebook, just type in the comments your questions. And today we're talking all about medication management, a hot topic, an important topic, and we're going to be diving in just a moment. And if you are just joining us, again, my name is Lakelyn Hogan. I'm Home Instead's Gerontologist and Caregiver Advocate, and you're joining our May Caregiver Live Chat. Again, we're talking about medications. And we know medication can be vital to helping us manage chronic conditions. And we know that aging adults often take multiple medications, and caregivers often play a vital role in managing someone that they're caring for is their medication. However, ensuring that all medications are taken properly and at the right time can be sometimes overwhelming for the individual who's taking the medication or for the caregiver who's helping to support them in their medication management. And we know that as the number of prescriptions that a person takes
Okay, well, it looks like we maybe lost Lakelyn for a moment. As she was speaking there, I believe she was talking about how, oh, there she is.
There we go. I apologize, everyone. I was just about to check my internet source. So we're back. I apologize, Kyle. I left you high and dry there.
That's okay. That's okay. We're used to that this day and age with new technology and everything.
Yes, you would think after a year on Zoom that I would have it all figured out, but here we are. Did you have a chance to introduce yourself, Kyle, or should I do the honors now of introducing you?
Go for it.
Okay, well, I think I was saying, as I accidentally cut out, again, my apologies, everyone, is that we're going to be talking about medication management, and I'm very excited to have an expert on the topic with me today, Kyle Decker. Kyle is the Vice President of Pharmacy at SimpleMeds. Kyle received his Doctor of Pharmacy degree from Butler University. He is Six Sigma certified and has spent the last 10 years at the forefront of driving quality. Kyle is a member of the Pharmacy Quality Alliance, the National Community Pharmacists Association, and the Indiana Pharmacist Alliance. So Kyle, welcome again. Thank you so much for being here today to talk with me about such an important topic.
So glad to be here. Yep. Let's dive into medication and management.
Absolutely. And I thought that we could start by kind of getting an idea of how many medications older adults usually take on average and why taking multiple medications can increase medication mismanagement.
Yeah, that's a great way to start. And you know, seniors take more medications than most Americans, but it's interesting because half of the US has at least one chronic disease state that requires a medication to be taken every day. So, it is a problem for our seniors, but it's also could, impact anybody in everyday life. And so we know that 57% of seniors take 4 medications every day, which can be a lot, but there's also 27% of seniors take 6 or more medications per day. And it's just like anything else. The more medications you take, the higher risk there is that you're going to forget one or take it at the wrong time of day or the wrong dose. So, more medications leads to a higher risk of medication mismanagement. So we want to obviously keep an eye on those folks that are taking more medications because it is difficult to manage.
Thank you for sharing those insights, Kyle. It is so interesting that as you get older, you have possibly more medications that you're taking, and I know just from helping loved ones manage their medications, it can be confusing from time to time, and so we know that being able to manage medications effectively is so important. And there's a term that goes along with that: medication adherence. And so it's probably something that we've maybe heard as people in the medical profession. We're probably well versed on what medication adherence is. But for those that might not know about it, would you mind giving us an overview on what is medication adherence and why is that term so important?
Yeah, so from a very high level, I would say medication adherence is taking the right drug at the right dose and the right time of day. Once you, I guess you would say, mess one of those things up, then you're instantly becoming non-adherent and not taking the medication as prescribed. And really the consequences can be very subtle or they can be very severe. So, it could just be a treatment failure where you have to add on another medication if you're not adherent to the first one. But it also could lead to adverse drug events and drug interactions and things that could be much more severe and lead to things like hospitalizations. What's behind a lot of that is getting timely refills, making sure that when you run out of medications, you have refills on file at the pharmacy so you can go get those filled. And when that doesn't happen, what happens is treatment failures and gaps in therapy is what it's called medically. A gap in therapy is when you're not taking a medication as prescribed for a period of time. It could be one day or it could be a month. And so getting timely refills and then remembering to take your medications. I tell my patients that are taking multiple medications that I feel like I'm not very old, but I forget what I ate for breakfast yesterday. So if I had 6 medications to take, I know I would struggle with just remembering when and what I took and how to do it. So those are kind of the high level, what is medication adherence.
Thanks so much for going over that. And I would imagine for some that during the pandemic, through kind of the lockdowns and people being at home longer, that COVID kind of impacted medication adherence. And I know you and I did a webinar recently and you shared some interesting information on that. Would you mind kind of recapping for this group?
Yeah, absolutely. So we're all a year removed from the surprise of COVID-19 and the trickle-down effect of the pandemic has impacted all of our lives. I think the biggest thing that we didn't expect was access to care problems. Patients either couldn't get to the doctor, weren't tech savvy enough to do virtual visits, those sorts of things, but also patients didn't act upon new symptoms or side effects of medications, new symptoms of their health that they normally would have just because of decreased access to healthcare. So that would say would be one of the biggest things. The shelter in place, there was social isolation, there was depression, anxiety, all of those things that go along with shelter in place, and that impacts your medication therapy as well. And I would say third, the economic barriers and the problems around folks being laid off, unable to find work, less income than normal, no longer have insurance, all of those things, that the economic barrier, we're starting to see less of that now, a year removed, but it's still there. And, at the end of the day, if a patient has the choice between going to the grocery and having enough food to eat or paying their copay for their prescription, 9 out of 10 times they're gonna go to the grocery. And that's just the fact of life, right? And so we saw a lot of that, patients not being able to pay their bills and needing assistance, signing up for copay assistance and other subsidiary assistance. And then I guess the delivery of medications would be the last thing, just folks getting used to having their medications delivered. People had that norm of going to the pharmacy and seeing their local pharmacist and having that interaction that's no longer there. So luckily today, even very rural areas, folks can get their medications delivered. And so that's been a win for us, but definitely a challenge early on.
Yeah, man, I can understand how those challenges really came about due to COVID-19, due to the pandemic. And so this might be a good time for families to kind of regroup with their loved ones, or caregivers regroup with those that they care for, to make sure that, okay, we're kind of through this pandemic. What doctor's appointments do we maybe need to reschedule or finally get to? Or maybe we do kind of a reconciliation, which I'm sure we'll talk about a little bit more about what that term means in the future, or in the future of this conversation. But I think that this could be a really great time for folks to just take an inventory. What medications am I taking? Double check that with your healthcare provider to make sure that those are what you should still be taking. And then if for some reason you stopped a medication due to the pandemic, couldn't access it, looking for ways to get back to that, or talk with the provider about that. And I know Crystal in our chat box, she chimed in and said that in her area, there were shortages of medications too because of the pandemic. So we certainly saw an impact there. And I know that, you, Kyle, had mentioned that during the pandemic, some people maybe had a symptom or a side effect of a medication that they maybe didn't act on because of maybe they couldn't get to the doctor, or because of the circumstances that they were in due to the pandemic. So are there some common signs that families should be looking for, or clues that their loved one might need some assistance with their medication management? I know that when I worked as a client care coordinator at our local franchise office, I would walk into a senior's home sometimes and see just a multitude of pill bottles on the counter. Some were half full, some were empty, some they had said expired years ago. So is that a sign? Is that one of the signs families should be looking for?
Oh, absolutely. Yeah, I kind of have a similar story, not during the pandemic, but my grandmother was notorious for when she would feel better after starting a medication, a couple of weeks in, she would stop taking it. So we would go in, once a week and check on her medications and check on her, and there would be full pill bottles. And then, the conversation would start, Grandma, how are you feeling? Oh, I feel fine. Well, why aren't you taking this medication any longer? And the story was always the same. Well, I felt better, so I didn't need to take it any longer. And, that's oftentimes a misunderstanding, especially in the senior population, that a chronic medication is intended on stay on that medication for a long period of time. It's not like an antibiotic where you take it for 7 to 10 days and then you stop. So full pill bottles, definitely something to look for. Expired pill bottles is an indicator oftentimes that they stopped taking a medication and shouldn't have. And then empty pill bottles a lot of times means they either have a gap in therapy because they didn't get the refill one, or they stopped taking the medication when it ran out because they didn't have any refills. And so keeping a track on what quantity the patient should have of their pills remaining on hand is a real good indicator. And I tell folks that the proverbial lift up the rock and see what's underneath, really get to the root cause as to why they are not taking their medications. Something else to look for, seniors know their bodies the best, and whoever's caring for them probably knows that the second best. And so those two individuals are going to be the ones that identify new problems. So new symptoms, there's lots of them that we can look for, but really anything out of the norm. So changes in behaviors, cognitive skills, speech, balance issues, or dizziness, upon standing could be a side effect of medication. They have nausea, problem sleeping or sleeping too much, changes in appetite. All of those things are things that we really need to be diligent on if we see or observe, or they mention, hey, I just couldn't get out of bed this morning. Could be a sign of depression. All sorts of different things that is best left to a healthcare professional to really identify what it is. But if you see those signs, then they need to be brought to that healthcare professional to be evaluated.
Those are some great tips, Kyle. And I do agree with you. Usually caregivers, they know their loved one really well. I know my body really well, so I know when something is off. And so those sorts of things really shouldn't be ignored. They should be brought to the attention of a medical professional, especially after someone starts a new medication. That could be one of the new symptoms that or side effects of that medication. So it is important for family members to be diligent. And then Kyle, what else would you suggest to help family members reduce the potential for medication risks or challenges? I know you have a lot of great tips on that.
Yeah, so you had mentioned a med reconciliation or medication reconciliation. Some pharmacies do this when a new patient starts, but really what the objective is to make sure that the patient's taking the medications they're supposed to, and that they're active prescriptions and not something that is no longer being prescribed. And so when that happens, what the intent really is to do is to have a medication list or legend of the drug, the dose, the directions, and the doctor. And there's lots of reasons to have that. From when you go to see your primary care physician or your specialist, to have that list of medications of all the things that the patient's taking, including over-the-counter meds, to give them so they're aware of the complete medication profile. But also just stick it on the refrigerator. If God forbid there's an ER visit, or something bad happens and there's a fall, that medication legend is going to be imperative when they get to the ER to know what the patient's taking or not taking. So that's where I would start. I would make sure that you have a list of all of those meds and that they're active and accurate. The next thing I would do is say, get a pill organizer system. My pharmacy, SimpleMeds, what we do is we pouch package medications according to the date and the time so that there's no confusion. But there's lots of other services out there, not just pouch packaging. You can just do the 1 week pill box reminders and set up a reminder on the loved one's phone so that they know at 10 o'clock they need to take their morning pills. And if say they only take 1 or 2 pills per day, just having a calendar next to those pill bottles and mark off on the calendar the day that they took their medication so that they know that's complete and there's no confusion over medicating or under medicating. So that's what I would say too. Also work with your primary care physician to simplify the medication regimen as much as possible. So what we know to be true is that the more times a day a patient needs to take a medication, the less adherent they're going to be to that regimen. So for example, there's lots of medications that have immediate release formulations of tablets or capsules. And that can be reduced oftentimes to an extended release once a day tablet or capsule. And that in itself, reducing the number of times from 3 or 4 to 1 can really increase the adherence and have a better therapeutic outcome for that individual. So anytime you can simplify the drug regimen, I would say absolutely take advantage of it. Sometimes cost can be a barrier there, but there are assistance programs to help out with that for those extended release version formulations. Also, making one doctor the gatekeeper of the medications is really paramount, because the more physicians, just like the more medications, the more physicians, the more chance there is for non-adherence. So making that primary care physician usually is the person, unless they have something like cardiovascular, chronic heart disease, something like that, where most of their medications are heart medications. Whoever is prescribing the most, I would suggest making that the gatekeeper to all medications, so that one person is responsible for that medication regimen. Know why the individual is taking the medication. If you're not aware of why, consult the pharmacist that's filling those medications. Research shows that if individuals know why they're taking the medication, they're automatically more adherent to taking it. So if mom knows that I take my blue pill for my memory, that's a win, and she's going to be more apt to take that medication. Like we talked about earlier, call the doctor if there's any changes. Make sure that when you have a regularly scheduled appointment, that loved one makes it to the appointment. And if they're not able to make it to the appointment, reschedule and make sure you hit that second one. There's oftentimes a synchronization to doctor's appointments that align with medication refills. So if a doctor refills medications for 6 months, oftentimes there's going to be a follow-up at 6 months. And sometimes lab work has to be done. So if the physician isn't armed with that data to help prescribe those medications, many times they're only going to give you one refill to get and the chance to get back in and get the lab work and the doctor's visit done, so that they can refill that medication. And that again goes back to gaps in therapy, and we want to make sure that there are no gaps in therapy, so there's success treatment, not treatment failures. And then I guess lastly, I would say consider home care. Consider home care for medication assistance. Wonderful providers out there, very capable of doing so. And anytime you can get extra assistance, especially if you don't have the time to go over and set up mom's pill box, there are people there to help. So I would definitely suggest doing that as well.
Kyle, those are really helpful tips. And I know at Home Instead, medication management is something that we often assist our clients with. And so for family caregivers, if you're struggling with medication management, that might be a great option. And I also love that you talked about SimpleMeds and the pouch packaging. I even use the pouch packaging from SimpleMeds because pre-pandemic, I traveled all the time, and it was just nice to have my vitamin and my allergy med all in one little pouch to take with me. And I know a lot of the older adults I've worked with over the years have found that to be a beneficial program. And so we'll drop the simplemeds.com website in the chat and on Facebook, so you can check that out as a resource. But so many great tips. And I think too, when we think about healthcare, we often think, doctors and we got to get to our doctor's appointments and have to ask my doctor all these questions, but pharmacists are often kind of the best kept secret, and they are a resource. Maybe I'm speaking out of turn, Kyle, but I would say that, pharmacists, you are probably among the most accessible healthcare providers because, you're at the grocery store when I go to get my refill, or you're at the Walgreens or CVS. So Kyle, would you say that, or would you recommend that individuals reach out to their pharmacists and ask some of those questions?
Absolutely. Yeah, that's a great point. Pharmacists, in my opinion, I may be a little biased, but are the best kept secret. And it is true that pharmacists are the most readily accessible healthcare professional that people can reach. So if you're not able to get into the doctor, you're not sure what to do if you can't get a hold of your doctor, the next best place to go to is to your pharmacy and talk to your pharmacist about, this is what I'm experienced. Can you give me some tips or what I should do, or should I go to the emergency room, or does it not really require an emergency room visit? Can I wait till Monday? Those sorts of questions, absolutely direct them towards your pharmacist, and they'll be happy to help you out.
Wonderful. Plug for the pharmacist. I love it.
Okay.
And I know that, there are times when caregivers might find medication management to be a little more challenging. Say, for instance, when their loved one has been in the hospital and now they're returning home, they have kind of this discharge sheet that they get from the hospital that says maybe some new medications, and they might be confused. Like, do I add that to my loved one's current medication regimen, or any tips there for family caregivers? Because I know that I encounter this a lot in the individuals I work with.
Yeah, that's a great point, Lakelyn. So we know that one of the biggest reasons for hospital admissions and readmissions is medication mismanagement. And the readmission is even a bigger problem. Say somebody goes in for a hip replacement or a knee replacement, and they have some sort of rehab. So they had their drug regimen they were on prior to admission. They have their drug regimen that they're on while they're in the hospital or the rehab facility, which is almost 100% of the time driven by that facility's drug formulary. So those drugs are going to be different than what was being prescribed prior to admission. And so they're on those medications while they're there. They're discharged, and the discharging physician will write new prescriptions. And those new prescriptions are intended to be sometimes taken for a short duration or chronic duration. And so what I would suggest is, upon discharge, is going through that medication legend that we talked about earlier, which you have all of the medications you were taking prior to being admitted. Have that with you upon discharge so that you can go through with that hospitalist or discharge physician and say, okay, which one of these are being replaced with this medication? Do a cross out, okay, I'm no longer taking this one, I'm taking this one instead. And going through each one of those medications and over-the-counter meds to make sure that the post-discharge med list is correct. Because what will happen is patients will end up doubling up on doses within the same therapeutic drug class. The discharging physician may not know that they're taking metoprolol at home before, and so they discharge them on labetalol. Well, they're both beta blockers. And then you end up with two medications in the same drug class. You get reduced heart rate, hypotension, so those sorts of things. I'm just throwing out examples, but real life scenarios that happen is they get doubled up on meds, or something gets missed and they don't continue therapy on something they should. So yeah, that's a big one. Just making sure all of those changes are accounted for post-discharge.
Those are great tips. I remember I was helping my grandma, and she was discharging from the hospital, and I was looking through her medications, and my aunt usually coordinates it. So I made sure that she got those discharge papers so that she could do that med reconciliation. And I know for my grandma at the time, it was kind of overwhelming. She was tired, she was leaving the hospital, and the doctor went through it, but it is hard to remember. So often caregivers are the best advocate for their loved one in their medication routine, no matter if they're just going for a routine checkup at the doctor or if they're being discharged from a hospital after a hospital stay. And we certainly want to reduce the number of times an older adult has to go to the ER. That's no fun for anyone, and reducing hospitalizations.
Yeah, and you make a good point. Having an advocate there upon discharge is so important, because if somebody is being discharged, they're probably not feeling well. They're tired. They have anxiety. They're, nervous about going home. All of those things. So having an advocate there upon discharge to help with those exact medication items is really, really important. But not only just medications, just discharge in general. When is my next physical therapy? How often am I supposed to be icing this? All of that stuff is very hard to absorb when you're being discharged from the hospital. So having an advocate there is really, really important. That's a good point.
Yeah. I would say another common challenge that caregivers sometimes run into is that their loved one doesn't think they need to be on medication, or they're leery of why a doctor is prescribing it. So any tips to help caregivers really help their loved one understand why medications are being taken?
Yeah, I would say a couple of different things. So one of the, I would say, challenges that we run into when we enroll a customer in our pharmacy where we do adherence packaging is they feel as though they're giving up their independence by having somebody do that for them. And what I argue with them about is, I say argue, I don't mean it that way. What I challenge them with is that you're actually regaining your independence. You're remaining independent longer by having somebody help you at least package your meds, help you get your refills on time. That will help you self-medicate for a longer period of time than if you don't do that and be proactive, and then you have a medication mishap and you end up in the ER or hospitalized because of an adverse drug event. So I would say that's one thing, is just give them the encouragement that they're being proactive and they're engaging in their own healthcare and their medication management, and that will help them become adherent to it. I would also say, help understand what their concerns are. Maybe it's why they're taking their medication. Why do I have to add this another pill onto my medication profile? And help them understand that that's going to help them stay healthy longer. Maybe they don't know how to properly take it, and that's where your pharmacist comes into play again. Is if they have COPD and they have trouble breathing and they have inhalers, make sure they're administering the inhaler medication properly. If they're not getting that medication all the way to the bottom of their lungs, then it's not working properly, and then they end up having another medication on their profile. Same with injectables. Make sure that they're dialing up the injector to the proper dose. They're not overdosing or underdosing. they're administering in their proper injection site in their into their abdomen instead of their leg. Little things like that we may not think of on an everyday basis, but can make a huge impact in your loved one's care and their health are really important. And then, like we talked about earlier, follow up with the doctor and the pharmacist if they need to learn more about the medication. What type of common side effects are there? Patients oftentimes get wrapped up in those medication leaflets that list 30 different medication side effects. Oftentimes, there's only a very, very few that are common. And so talking to your pharmacist or doctor about what they can expect rather than all the things that could happen is really important as well.
Thank you for those tips, Kyle. And I love what you said about the independence piece. I think that, as you age and you start to maybe lose a little bit of your independence, it can feel like, giving up one more thing, the medication management, something that I've always been able to do for myself, that might feel like you're being robbed a little bit of your independence. But if family caregivers can empower their loved one to be part of the solution of figuring out, okay, what's going to be the best way to help you continue to manage your medications on your own? Maybe it's setting the cell phone reminder, or I love that calendar idea that you brought up, Kyle, kind of making a medication tracking sheet. And I know at Home Instead, we developed a program called Let's Talk About RX. And there's a website we'll post in the chat and on Facebook, but there's a simple medication tracker on there you can download. So there's great resources that exist out there for people like SimpleMeds. You mentioned the little pill organizers. I know that there's also automatic dispensers as well. Kyle, any other tools that you have seen work well for the patients that you've encountered over the years?
Yeah, the medication dispensing device can be really helpful. And there are some good ones out there that integrate with apps on your phone. If your loved one's tech savvy enough to do that, where they will dispense the pouch at exactly the right time to be taken. And if it's not removed from the dispensing device, it will alert the loved one that mom did not take her medications. And it's a really good way if you have, I would say, ongoing issues with medication management. That could be a really good resource for you. But I would just reiterate, just make sure that the loved one feels like they're a solution to the problem. Oftentimes they don't want to be trouble or, take away someone's time for their help of their medications. But if they feel like they're a solution to their own problem, they're going to be more adherent. They're going to be more involved in their healthcare. And I think at the end of the day, that's really important. I would also add that it's a good idea to go through, some patients keep all of their medications in a cupboard somewhere, out of the reach of children, which is very important. But oftentimes when patients are discontinued on one therapy and started on another, or no longer need to take a medication, they just kind of throw it in the back of the basket with all the pill bottles. And that's a concern for pharmacists for a lot of reasons. One, medications can get in the wrong hands of individuals. And so we worry about that, loved ones included. Controlled substance medications are highly sought after on the black market. And so that can end up in the wrong hands. But I would say more often than not, it's just confusion with whoever's taking those medications. Taking expired medications. Oh, well, I ran out of this refill, but I have an old one that I used to take that I'll just substitute it for. Unbeknownst to them, it may cause problems. And so disposing of medications properly is really important. There's often drug take-back programs from the local sheriff or police departments, health clinics, pharmacies. So I would say take advantage of those opportunities, get rid of those medications that are no longer being used. There are ways to dispose of them in your own home. So mix them with used coffee grounds so that it actually makes the medication not desirable anymore. And you can also flush most medications. I say most. The FDA has a link on their website for medications that are not safe to flush down the toilet, but most medications can actually be disposed of down the toilet. So something else to keep in mind is just keeping that medication list active and actually coupling that with what they have on hand and not get rid of those meds that they don't need anymore.
Those are some more great tips. And I think that the disposal of medication is something that also is of concern for caregivers and individuals. They don't know, should I throw it away? Can I flush it down the toilet, or should I throw it in the trash? We've kind of heard mixed messaging over the years. So that's great that the FDA has that list of do not flush kind of medications, and drug take back days at pharmacies are always a helpful resource as well. So Kyle, gosh, you have shared so many great tips so far. I know we have some questions coming in from our audience, and so we'll turn to some of those questions now. And if you're on the chat and you want to ask a question of Kyle or myself, Kyle's more of the expert in this arena, but please feel free to chat them in the Q&A box or the chat function on Zoom. Or if you're watching on Facebook, just drop it in the comments below your questions in the comment section, and we'll tackle as many of those as we can. Our first question comes from Brenda. She says, should side effects to meds be tolerated? Kyle, what are your thoughts on that?
Yeah, I would say in general, some medications will have a side effect take place early on in therapy, and then will subside once your body adjusts to it. And if that's something that is expected when you talk to your pharmacist or physician about what to expect with starting a new drug, if that's something that's expected and is expected to go away over time, then yes, I would say it should be tolerated. If it's not tolerable, which can be the case, even though it's expected, then I would consult a physician. Maybe the dose needs to be started at a lower dose and work your way up to titrate to the right dose. So there's different ways to handle that. And I would say it's a case-by-case scenario, just like, a lot of patients' medications they're your medications for a reason. They're specific to you and your body. And so making sure that you consult with your physician on what those side effects are to be expected and how to handle them. And if they're too extreme, then that's when you need to pick up the phone and call the doctor's office and work through that. There's many types of alternatives depending on what drug class they're being prescribed. So maybe you need to try a different type of medication within that drug class. So again, I would just say it's specific to each case, but to work through that with your physician and pharmacist.
Those are great thoughts there, Kyle. Thanks for those thoughts. And Brenda, thank you so much for that question. Crystal has asked, we kind of covered this a little bit already, but are there pill dispensers that you would recommend, especially for someone on a budget? Kyle, any thoughts there?
So many of the pouch packaging systems today have some sort of integrated application that does everything except advancing the pouch. So they'll come in a box with the pouch according to the next administration time and medication. So everything is there. And the pill reminder through a tablet or iPad or iPhone, all of that can be incorporated. So you're really not missing anything except the advancement. And so I would say those medication services are typically free. You just pay your copay. So if you're on a budget, your copay should be the same there at a pouch packaging facility or service versus going out and buying a dispensing device that costs, upwards to $1,000. And oftentimes in those pill dispensing devices, someone still has to set them up. So that's kind of a drawback to if you already have somebody pouch packaging them for you, or your local pharmacy will deliver them pouch packaged, then I would say that's probably the best solution if you're on a budget, because almost every time it's just the normal copay.
Thank you, Kyle, for that. And I know Kyle has said pouch packaging systems, and SimpleMeds is one of those. Kyle works for SimpleMeds, and so we'll make sure to include that link in there, Crystal, so you can feel free to check them out. I use them, and I love the service. It's super simple, and they send you a reminder that your next box of your 30-day supply is coming. So they make it really easy, and there's no additional cost, which I think is great. So thank you all for those questions. And Brenda, she's just giving us a little bit of a shout out. This talk has been encouraging to her. So Brenda, we thank you for tuning in today and joining in, and for all of you. We have some great questions coming in, and please keep them coming. I know, Kyle, you and I usually do a webinar on this for a CE credit through the American Society on Aging. And so if you want to watch our latest full webinar, we'll put the link in the chat box. It's geared more towards professionals working in the aging field, but there's still so much great information. And one question we usually get every year is around individuals living with dementia and challenges that medication management brings when there's some sort of cognitive impairment. And so, Kyle, I thought maybe we could talk a little bit more about that. I can kind of start it off with some kind of caregiving related tips that usually works if an individual is refusing medication, and then I'll turn it over to you and see if you have any additional thoughts.
Sure.
But I know that when someone is living with cognitive impairment, dementia, Alzheimer's disease, there are sometimes some dementia-related behaviors, such as refusal. So someone might be refusing to take medication or refusing to take a bath, those sorts of things. So we often see this to be a challenge, more so in the moderate to or middle to late stage of the disease. And so often it's all about the approach. So you might try saying, okay, it's time to take your medication. And the person might say, well, no, I don't want to do that. And so it can be frustrating for a caregiver in those situations. So sometimes it's helpful to make sure that you're making eye contact with the individual, that you're speaking slowly, letting them process the information that you're sharing. So you might say, hello, it's time to take your medication. Make sure that you have their attention. And sometimes you have to break it down into easy steps. So you might say, here, I'm going to place the pills in your hand. I'm going to hand you this water glass. You'll take the medication and then drink the water. And sometimes doing those actual actions can help to trigger in that person's mind the steps that they need to take. Due to the progression of the disease, sometimes they just need a little visual cue or reminder, a little step by step. And sometimes it's important to also kind of explain what the medications are. I liked Kyle's example earlier. He said, you might tell the individual that blue pill is for your memory. You don't want to maybe use the complicated, true term of the medication, but you might want to simplify it. Or, this white pill is for your back pain. It'll help make your back feel better. So just kind of more of those simplified explanations can help, again, make sure that the individual knows what they're taking and why they're taking it. And so those are a few of the tips that I have seen work over the years. And sometimes you just kind of have to walk away, do something else for a little bit, and come back and approach medication again after a few minutes have passed. So the same thing might not work every time. You might have to switch up your approach, but there are some great tips. And we have a great website called helpforalzheimersfamilies.com. We'll make sure to share the link in the chat function and on Facebook. There's a quick tips section, and there's one about medication management, so you can learn more there. But Kyle, would you have anything else to add? If an individual has cognitive impairment or memory loss, any tips for medication management?
Yeah, I love the thing that you just shared. One of the things I would say is that there are a lot of times patients get dysphagia where they have difficulty swallowing. And pills can be difficult to swallow sometimes, large pills. They like to get stuck in the throat. And so there are pharmacotherapy alternatives. So there are sprinkle caps that you can open and put in cereal or applesauce. Or some pills are made to be crushed, and so that the patient can get them down easier, mix them with, yogurt or applesauce again. And so that may be something that folks run into out there, is that patients don't want to swallow the pills because it's not easy to do and it's hard to do. So another thing to talk through with your pharmacist or physician. And then you may experience the same repetitive questions every day or same repetitive problems every day. And so I would say just be prepared for that. And if that starts to happen, think about what questions come about each day and address those before they become questions. Because oftentimes those questions create anxiety and nervousness around the medication. And so if you can talk through them about those things before they get nervous and ask the questions, a lot of times that'll make the process go more smoothly. And then you kind of hit on it already, but be patient. don't argue. Those very basic things are really important, because if you can try to put yourself in their shoes, that they're struggling, and so however you can alleviate that anxiety is very helpful.
Those are some great added tips. Thank you, Kyle. So yeah, I think that we encounter so many different medication scenarios. Someone might be struggling with cognitive impairment. Someone just might be a little overwhelmed by the new medications that they're taking, or maybe someone's just come home from the hospital and they're trying to figure out the medication list, the new one compared to the old one. And I think what I would boil this chat down to is it's important to make sure that you consult your pharmacist, and it's important to have that medication list up to date, and to make sure that your loved one has the medications they're currently taking, and then discards the ones that they're no longer taking, just so that it minimizes confusion. Because if we're able to help our loved ones and the people we're caring for be empowered in their medication management to develop a comprehensive system that works for them and for the caregiver, hopefully there's just the best case scenario. The medication plan is working, the individual feels good and feels confident in their medication routine. So thank you so much, Kyle, for joining me today. It has been such a pleasure. I always enjoy talking with you about this subject.
Likewise, Lakelyn. It's an honor and a privilege. So I really appreciate the invite, and enjoyed speaking about all things medication today.
Wonderful. Well, thanks again, Kyle. And we thank all of you for joining us for this topic today. This is part of our Caregiver Chat series sponsored by Home Instead. And we do these each month. So next month, we're going to focus on spirituality and dementia, and we'll talk about how religion and spirituality and faith impact, or how those things are important to the individuals living with dementia and those providing care and support. And so I'll be joined by David Troxel, a well-known dementia care expert. And so I hope that you will join us. That will be on Tuesday, June 15th. And we always post the information on our Facebook page. You can follow us on Facebook. And we also post it on our helpforalzheimersfamilies.com page. So we hope to see you back next month. But in the meantime, thank you again for joining us. I hope you have a good day, and please be sure to take care of yourself while you're caring for those that you love. Have a great day, everyone. Bye.
Thanks, everybody.